Hello, everyone. My name is Tom Wolf. I'm very happy, pleased today to welcome you to the first release of the third round of a survey of residents of Nairobi's low-income areas. But I have cooperated with them in developing the concept of this research project, and we received sufficient funding to conduct 3 rounds. The respondents in rounds 2 and 3 have been the same ones we interviewed on round 2, because our objective was to see how the COVID-19 virus has affected residents, especially of Nairobi's low-income areas. And we thought it would be very important to look at both the medical, the public health aspects of this crisis, if we can call it that, I think we can, as well as socioeconomic, the socioeconomic impact of the virus, which, as everyone should know, to a great extent is a reflection not so much of the virus itself, which up to now has infected, according to testing, only around 40,000 Kenyans, although about a third of them in Nairobi, and caused the deaths of now between 700 and 800 people. I'm not saying that this is not a very sad and serious public health impact, but the social, economic impact of the measures that the government has put in place to try to contain the virus, in common with the situation in many other countries, has affected people very, very greatly. All you have to do is to look at projections for economic growth globally and in Africa, as well as in Kenya, to see what impact, very, very damaging impact that this virus is having and will continue to have, at least until there's a vaccine and the bulk of the population can receive that vaccination. So our the first round of the survey was conducted in April, the second one at the end of June, end of June, and we held off a bit to do round 3, which has just been finished about a week ago, to give a little more time and see how things have changed. The government, through the president, has made some changes in some of the requirements or restrictions affecting people, both personally and economically. And we wanted those to take effect so we could try and capture the current situation. As I said, these 3 surveys are covering quite a variety of issues. And therefore, for round 2 and now round 3, we're breaking them up into particular segments or releases. In round 2, I believe we had 5 different releases, each one covering a limited range of topics, and we'll be doing the same thing now with round 3. The first release, which I'm presenting today, is dealing with just really 2 issues, and that is the impact on children's education, how they're managing to cope at home for those who are able to access educational material, and what the parents in the households think about this. I think we can now begin the review of the results. Now I'll take you through, as I said, the findings from this release covering those two topics. You can have a quick look here at the topics that other releases, aside from this first one, will include, and they're basically the same issues that we have covered in rounds 2 and rounds 3, rounds 1 and round 2. I should say that based on the findings that we obtained from round 1, we did make some minor changes in the questionnaire. A few questions we deleted, a few we added, and the same thing we did with round 2. Perhaps the only thing I'll say about the methodology is that all the interviews were conducted through smartphones, a computer-assisted telephonic interview methodology, and this allowed our interviewers to obtain the information without going into residential areas themselves. So the first of the two headings on children's learning at home, and also the issue of when children return to school, as some classes are supposed to from next week. What do parents think about that in terms of the fear of their children becoming infected? So first of all, of our total sample in this survey, which was 555, we had 3/4 of them, 76%, reporting that they have school-age children who are now at home because schools have been closed. And as you can see, a somewhat higher proportion of female respondents said this. Obviously, there's some people who live alone or they're single parents. That applies more to women than men. We know in our sample that more men are living alone than women, and living alone means you don't have children. So this higher percentage of women reporting that they have kids at home makes sense. On the left side, of all of those with children at home, which is 422 households, fewer than half, only 40%, say that their child or children is able to access any of the educational content that has been posted, made available by the ministry on several websites. And one of the points discussed in more detail in the presentation is we just raised the question, if it's only 40% for kids in Nairobi, even if this is low-income areas, what must it be in rural parts of the country? And on the right, we have a graph and showing the responses to the next question, which is for those children who are accessing any educational content, what's the main way that they're doing that? And you can see that 2/3 of them, their main way of accessing is either through television or through a smartphone. That's not to say there aren't some other modes that are being used as the main way, whether it's radio, even reading some books, having a tutor, a computer, and so on. But because people, our respondents are reporting these different modes through which their child or children are accessing this material, we had no way of really determining what specific material they were accessing. That would have been quite a complicated question to ask, and also in terms of compiling the data. But as I say, you can see the two main modes of access by such children are television and smartphones, and radio in third place. Then we asked our respondents, again, who have children who are accessing such material, how useful they considered this material to be. Now that question presumes that the adult in the household who's being interviewed pays at least some attention to what their child or children are accessing. And in response, we got 1/3, 34%, who consider that material very useful. Another 27% consider it somewhat useful. Just over a quarter, same percent, consider it only a little useful, and only 10% feeling that it's not useful at all. So we can say a slight majority. If we add the 34%, the 27%, we get 61%, between half and 2/3 of these parents considering that the educational material their children are accessing is well worth it. And then we asked, well, aside from the children being able to access this material and the perceived value of that material, how much attention are the children actually giving it? And we find just over a quarter, 29%, are giving that material a great deal of attention. Another 18% are giving it some, but 41% are giving it only a little attention, and 9% none at all. So it's really a 50-50 split between those who are giving either a great deal or some attention, and those children who are giving that material only a little or not at all. Now, I should say that we did not ask this question in either of the previous surveys, so we can't compare, can't see the trend here. But my guess is, as the period in which children are away from school has dragged on and on and on, notwithstanding the fact that over the last few months, we have waited to hear, and in many cases with some optimistic expectation that schools will soon reopen, which didn't happen until now, there may have been a slacking off in the level of attention that children have been paying to this material, not knowing really when they're going back to school. But as I say, we don't have data to support that. Obviously, if we do a fourth round of the survey and at least a significant amount of children continue to stay home, we would be able to track this moving forward. We then took the results from the last two questions and we constructed a very simple hypothesis. And the hypothesis was, where the adults being interviewed in our survey feel that the content is of higher value, there would, other things being equal, more attention being paid to that content by their children, at least in part because of encouragement from the adults in the household. And sure enough, that's exactly what we find. If you look at the far left on this chart, where the respondents, the adult being interviewed, considers the educational content that their child or children is very useful, half of them said that their child or children are paying a great deal of attention to this material, which was the highest ranking. By contrast, if you look at the far right, those who felt only 12% report that their child or children were giving it a great deal of attention, with 41% giving it no attention at all, which contrasts only 3%, on the far left again, of those who have children, respondents who consider that material very useful are not paying any attention to it, giving it any attention. So in this sense, we have proved our hypothesis largely correct, that the higher value with which such educational content is perceived by the adult or adults in the household, the more attention their child or children are giving it. Now we come to the issue of being infected by the virus. And we wanted to find out, assuming that schools reopen and some classes have been called back for next week for examination year classes, how anxious are the parents or adults in the household about their children going back to school in terms of being infected by this virus? Now, first we wanted to find out the respondents themselves, the adult being interviewed, him or herself, how worried are they about being infected? Obviously not in school because they're adults, but in their daily routine. And we can see on the far left that 44% are very worried. And men, only 35% are very worried, as opposed to 51% of women who are very worried about getting infected. And you can see the results for the other categories of somewhat worried, only a little worried, and not worried at all. Now we're going to turn to their concerns or level of worry about their child or children. Next, we turn to the issue of the anxiety, which adults, parents may or may not have about their child or children contracting the COVID-19 virus whenever they happen to go back to school, some the coming week and some perhaps not until next year. But before asking about that, we wanted to look and see whether the respondents, that is the adults themselves, are worried about possibly getting infected. So when we took from our sample just those who have children who are now out of school and asked them, how worried are you about getting infected wherever in your daily routine, we found that 44% are very worried, 9% are somewhat worried, 11% only a little worried, 36% not worried at all, with quite a contrast in this regard between men and women, with women considerably more anxious or worried about getting infected, 51%, as opposed to men, 35% being very worried, which is a little counterintuitive since we're told by public health people that men are more susceptible to the virus than women. And men also, other things being equal, spend more time out of the house mixing with other people where they might get infected. Be that as it may, what we wanted to do, again, to construct a hypothesis. But first we wanted to find out how worried are they about their children, as I said, getting infected when they go to school, whenever that is. And so we simply posed a yes or no question. When your children or child returns to school, are you worried about them getting infected? Yes or no? We find quite an overwhelming majority, between 2/3 and 3/4, 70% are very worried. Slightly more women than men have that worry, 73% versus 67%, not a very big difference. Again, just whether they're worried about their child or their children getting infected. Now, the hypothesis that we constructed, very simple one also, we made an assumption that those who are most worried about themselves getting infected would also be more worried about their child or children getting infected when they go back to school. And that's what we see in the next chart, where we divide our respondents into two groups, the red and the green. The red are those who are either very worried or somewhat worried about personally getting infected. And the green are those adults who are only a little worried or not worried at all about themselves getting infected. And we do see a statistically significant difference or contrast, not huge, but quite a contrast. 56% of those who are more worried about getting infected themselves say yes, they are worried about their child getting infected or children when he, she, or they go back to school, as opposed to 44% of those, when we're looking at those who are only a little worried or not worried at all, thinking that this will happen to their child or children. As I said, it's not an overwhelming contrast, but it's certainly one that is measurable statistically. So I guess the takeaway from this, I can say, is as parents or other adults in the house are thinking about their children going back to school, how anxious they are will depend not only on whether they think the school is prepared and has put in place the measures that have been required, clean water, enough soap or hand sanitizer, masks and so on, enough space for the children to sit apart from each other to maintain the proper distancing, but also how worried they themselves are about getting this very, very dangerous virus. And we discussed that in some of our points at the end. Now, the second topic, as I said at the beginning, in this release is domestic violence. And here in this first slide, we present the results from this round with the comparisons with round 2 shown in the green boxes above the graphs. And this question was just a yes or no. Are you aware of any increase in domestic violence in your locality since the first institution of the curfew, which is way back in March? And we can see that 52% say yes. Yet in round 2 in June, only 37% said yes. And then we have the contrast for men and women that are really not measurable. 52% for men, 51% for women, and so on and so forth. But overall, we see a significant increase in the proportion of our sample who in September are reporting such an increase in domestic violence as opposed to June. And again, we have three categories: violence against women in yellow, violence against women and men, and violence against children in blue, where there is more reported increase in violence against women than against individuals in either of the other two categories, with those levels against violence against men and children about the same. For total, for all the respondents, 37 and 36%, basically a statistical tie. And for those who reported any increase in such violence, we then asked, what form or forms has this violence been taking? And we gave them the options of it being physical or verbal, or both physical and verbal. And you can see that for all three categories of domestic violence victims, women, men, and children, the combination of both physical and verbal violence is the highest. It's an absolute majority for women, 52%, and it's plurality, that is the highest number, for men, 39%, and for children, 46%. And again, we've got the contrast in the green boxes above those graphs of the data from round 2. So we can see that the combined violence against women of both physical and verbal has gone down a bit from 59% in June to 52% now. Even if you saw in the earlier slide, overall, the level of reported increase in such domestic violence has increased. Now, we know that there are various organizations, NGOs, both Kenyan and international, that are trying to deal with this question of domestic violence. I see, in fact, just saw an announcement that the Kenyan Association of Residents Association, KARA, that's also supported by the Hans Seidel Foundation, as you saw, one of the organizations, the supporters of our surveys, is having a webinar on Tuesday examining this issue of domestic violence, I presume for the country as a whole, not just for the low-income areas of Nairobi that's been the focus of our survey. But I would suggest that where the economic pressure has been greatest, which is mainly on poor people, and when social and economic tensions have been highest, as they tend to be in congested urban areas, that the levels of such domestic violence would be higher among our surveyed population than for Kenya as a whole. But that's an assumption. And unless we have other surveys that are surveying either in rural areas or other towns, or even if the sample is big enough, the whole country, we're not in a position to make firm statements about the level of such violence. But we hope that our study will make some contribution, as I said, to these two very, very pressing issues at the level of individual families. That is, dealing with the children's educational needs during this long period that they've been at home, nearly an entire academic year, and the question of domestic violence. Thank you for listening, watching this presentation. We hope it's of use to you.